Hey there, I am Dr. Jill Wener. I'm a certified conscious health meditation instructor and I'm a tapping practitioner. And I get questions all the time from people, which one should I do? Should I do tapping or should I do meditation? And doctor, I have an answer for you here in this video. Doctors, I want you to keep listening until the end because I have content and services geared directly for you. And so I'll be speaking about that at the end. So this is such a great question. Meditation, I'll start by talking about that. The kind of meditation I teach is super easy to do. Anyone can do it. Thoughts are allowed and welcomed in this type of meditation. You're going to be sitting with your back supported. You're always going to be sitting comfortably. If you have an itch, you scratch it. It's a new take, well, it's not a new take on meditation, but it's a new approach to meditation that you may not have heard of. It's very different from mindfulness, and it's easy and it's fun. So it's going to take that slog mentality out of meditation. And we're not trying to work against the mind, but we work with the mind at whatever pace the mind is wandering off. This is actually like sanctioned daydreaming. So the meditation is really great. Why should you do it? So let's say you decide, okay, fine, I'll take a chance and try this new type of meditation. This meditation, what it's going to give you is really a global shift in the way that you perceive your life and that you handle stressors. And it's going to shift your stress levels. So all day long, we're kind of amped up on stress chemicals, and that's the sympathetic nervous system. That's the fight or flight response. And what's going to happen with this type of meditation, it's up to 5 times more restful than sleep, and it's going to shift your body into the opposite of the fight or flight, which is the parasympathetic nervous system. That's all about rest, digesting, better immune function. So what this practice is going to do, it's going to shift your stress levels and your chemical levels in your body, and that's going to automatically improve how you feel, how you relate to other people, how you enjoy your life, and also how well your body functions. So when I work with my meditation students in person, it's not one-on-one generally, but it's small group setting. And so I can check in with every single student and see how they're doing with their meditation. So by the time they're done with the 4-part course, I know that they're doing it right. And it is actually so easy to do that everyone can do it by day 2, if not sooner, in the 4-part course. For the online courses that I teach, there is a Facebook group for each course that you have access to for a lifetime. And so within that group, you're able to ask questions of me, of the group. And then I have a bunch of modules in the online course on how to troubleshoot your meditation and how to approach your thoughts in meditation, because those are always going to come up. So there's lots of support either way, so that you can have some sort of gauge on whether or not you're doing it right. Now, tapping is related in that it helps you with stress, but it's going to be used more for a specific issue or a more situational use. So it's going to be immediate benefits, and it's targeted to a specific problem rather than this whole global shift in the way you live your life. The way that it works is we don't focus on positive affirmations. We're focused on negative emotions or negative situations you might be experiencing. And as we tap on, it's the same energy meridians used in acupuncture and traditional Chinese medicine, but instead of using needles, we tap on them. And most of these meridians are on the face and on the chest. As you're tapping on the chest and saying things out loud about the negative emotions that you're feeling, that tapping is actually sending calming messages to the stress center of your brain, the hippocampus and the amygdala, and it's reprogramming how that stress center perceives a stressful event or something that was previously distressing. So tapping is amazing for trauma, for PTSD, for chronic pain, for acute pain, for just processing difficult emotions in general, difficult relationships, big life changes. If you have a big decision you need to make, tapping's great for that. And it's also really great to help you manifest positive things in your life too. And it's really, really amazing. And you get a very demonstrable return on your investment. So if you're doing tapping, you're going to see very quick progress, and you're going to get long-lasting benefits and some really cool self-discovery, because as you're tapping, it's kind of peeling away this facade that stress puts around us, and it allows you to receive messages from your intuition and your subconscious that really will be quite powerful. So when I work one-on-one with my tapping clients, I'm there with them, and I get in alignment with them, and I get a whole history of their issue and a personal understanding of each student. And I'm able to adapt the session to immediate real-time feedback with them. And there's really this depth of how deep we can go into the session. There's a lot of introspection that happens, and I can help facilitate that. And I also provide a safe place to do that, especially if you're dealing with things like trauma or PTSD or other painful events in your life. It's really important that you have a safe place to do that. So another thing to understand is when you're taking an online course about tapping, it's going to be a little different because I'm not there with you, but I provide the recipe for how to do the tapping, and I give time and pause in between each tapping sequence for you to do your own introspective approach to it, and for you to help you tune into yourself. And so it's not the same, obviously, as the one-on-one, but that introspection, that's also included in a different way in the online courses. So a client that I've had and how I help them choose which service. So I've had a ICU nurse reach out to me recently during the time of COVID, and she said, you know, life was stressful enough. I actually have a husband at home who's sick and dealing with a brain tumor. Life was stressful already, but now with COVID, I am losing my mind. What service can I do? And so the first thing I recommended to her was meditation, because when you're in fight or flight mode, that constant stress, it's really, really hard to, it makes it harder to make changes and to feel better when everything in your life is feeling very stressful. So I recommended to her meditation. And then she also wanted some help processing the grief, the grief and the difficult emotions of dealing with her husband's brain tumor. And so we're doing tapping as well on top of that. And now you can do both. It's really important. Meditation and tapping work really, really well together. Meditation sort of tills the soil of your brain, and it makes everything work better. So in addition to meditation giving you its own benefits, it's also going to help you be more receptive to the benefits of tapping, and really anything else that you try: therapy, medication, other energy work, self-help books. All those things are going to work better with meditation. So really, in an ideal situation, you could do both. But if you're having really, really big global stressors in your life that are just you're finding it difficult to go through day to day, meditation is going to help you calm down with that. But if you have like a breakup or a trauma you want to work through, or a phobia, that's when tapping is going to be really good. Now, doctors, why should they take the time out of their busy schedule to learn either one of these? And I really think that doctors can benefit from both. Meditation, and this is assuming that we all understand that the system needs to be fixed, but I have worked with doctors who have thought that they understood what meditation was, and what they did other types of meditation practice, and then they learned my type of meditation, and they say, oh my God, this is what I've been waiting for. This is what I've been missing this whole time. So the meditation is going to help you with what's called adaptation energy, which is your bank account of patience. It's going to help you surrender some of that need to control everything, and it's going to really help you get your compassion back and really increase your empathy. Tapping is really great for doctors because it can help you in those really, really painful, specific moments. I had a client of mine who used it right after she had got, she's a surgeon, and she had a patient of hers yell at her over the phone about a bad surgical outcome, a side effect that she had had, which was a complication that was normal and something that was not preventable necessarily, or that she had done anything wrong. And she used tapping right after that, and it helped her really process that emotion very quickly without pretending that it didn't happen, without trying to hide it. But she just felt a lot more hopeful. She felt a lot more energized. And normally she said she would have spent the whole day ruminating about that patient interaction. So I offer meditation and tapping. They're both incredible. I use them both regularly, very, very regularly. Meditation for me twice a day, and tapping usually at least once a day. I offer online courses and I offer in-person courses. The online courses are very adaptable to what you're doing on a day-to-day basis. I have an online course for physicians that is specifically designed for physician burnout, But I also have an online course that is how to create your own tapping sequence. So not just physicians, but anyone can really benefit from the online programs. And then the tapping one-on-one sessions I do, those are done in person and those are also virtual. That's if you want to take your practice a lot deeper. And if you really want to focus on a specific life issue, we can do a package and work through that together. Meditation is a continuous methodology. It's a lifestyle change. It's a new consciousness for you. And tapping is going to be more of solving an acute problem, an immediate pain, or a trigger, something that really triggers you a lot. They work incredibly well together. If you're interested in the online meditation courses, you could just visit the meditation page on my website and on jillwener.com. Tapping, there's also a page on tapping. I have a bunch of online courses, the online meditation courses. There's a CME-accredited one just for doctors and healthcare professionals, and then there's one that doesn't have any CME, little less medical jargon, same technique. So all you need to do is find the links for those on my meditation and tapping pages. If you're interested in one-on-one, you just go to the tapping page and follow the link to one-on-one sessions, and you'll learn more about how to register for those. And if you really need more help figuring it out, I'm happy to talk with you. So just contact me in the contact section. We'll set up a time to talk, and you can decide which one you prefer, meditation or tapping, or maybe both, but I'll help you figure out what's best for you.